This month is Pelvic Floor Dysfunction Awareness Month. It is important to understand how crucial pelvic floor health is and the conditions that can affect it.
Yeah, Dr. Wendy McDonald joins us now to break down the symptoms to watch out for, as well as exercises that can help. And we're not just talking about women. You said everybody's got a pelvic floor.
Everybody, every human has a pelvic floor. Okay. Like the pelvic floor is the bowl of muscles that pretty much holds our insides up and not from falling out of our bodies.
Okay.
I brought a model.
Okay.
Of course, this is a female pelvic floor. Well, this is a female pelvis. So we have the uterus, which I'm going to take out, and then we have a bladder, which I'm going to take out. And a rectum, which I'm gonna take out. And what's left is the pelvic floor. It's literally a bowl of muscles.
Oh, interesting. I did not realize that.
And it's what keeps us from urinating on ourselves most days or passing gas when we don't want to. It's what helps us have bowel movements. It's what we use to push out babies if we do that. So it's very useful.
Yeah. What sort of symptoms should we be looking for?
So typically pelvic floor dysfunction can manifest in a couple of ways. It can be either laxicity of the pelvic floor, so too much stretch, or tension of the pelvic floor, so too tight.
Okay.
The tightness can manifest as pain, difficulty passing bowel movements, pain with intercourse, just pain typically. Laxicity can manifest as losing or leaking urine.
Yeah.
Can't get on a trampoline, or you're trying to run to the bathroom and it's coming out before you want it to, or you're trying to hold in gas and can't. That's laxicity. So we're looking for those signs to wonder if there's potentially a dysfunction there.
Well, laxicity, I know a lot of us women know that can happen in childbirth. What causes the tension part of that?
Sometimes it's just challenging bowel habits.
Oh, okay.
You have children who may have difficulty with having bowel movements or the timing of bowel movements, and that can actually translate into adulthood where people don't know when and how to relax their pelvic floor. Another thing that I know a lot of people were taught, myself included, is when you're using a public washroom to actually squat and not sit on the toilet, but that can also lead to a level of pelvic floor dysfunction.
Interesting.
Give us an idea in terms of pain, because some people have discomfort there. I've eaten too many tacos. Hey, stomachache. When is it time to call the doctor?
If it's disrupting your life, you're not able to, you're trying to build your life around either your bowel movements, or you're unable to do certain things, again, like potentially intercourse, or just live a comfortable life. Some people can't place tampons. There's certain things that maybe would make a person uncomfortable. Or again, you're leaking, that is disruptive. Can you imagine you're trying to, do whatever you're doing, you're in the grocery store line and you have to run out of the line because you have to go to the restroom because otherwise you're going to have a problem. That's definitely time to talk to somebody.
And when is it more than just inconvenient or potentially embarrassing? When is it possibly dangerous for you?
Well, danger, the pelvic floor your body has it, so it's always there. It's not like you're really going to have your organs fall out. Though there is a such thing as prolapse. That is a thing, but it's a rare occurrence. It's more so just lifestyle and quality of life. Understanding that you don't have to live in a space where you're not taking care of this.
But there are exercises we can do to help things out. Can you talk about that?
Correct. So there's Kegel exercises, and you have to be careful with Kegels. Kegels are the squeezing and holding of the pelvic floor as though you're trying to hold in urine. Most people will tell you to do that for 5 seconds, maybe 10 times in a row, 2 to 3 times a day. That's if there's laxicity. So you have to be careful that you're not doing it if you're dealing with tension or pain, because you can actually work those muscles. But even something like hip bridges, where you're laying on your back and you're lifting up your pelvis, that can help to tone the pelvic floor. The happy baby pose, where you actually put your hands on your heels and kind of bring your body, your hips towards yourself, like a baby that's happy on the floor. That can help to relax the pelvic floor. And even something like diaphragmatic breathing, where you're breathing through your lower abdomen as opposed to your chest. That can also help to relax and even kind of tone the pelvic floor in a more safe and healthy way.
What ages should we be concerned or start to do these exercises?
Well, again, it depends on the person. Not everybody, I think, even
needs. I was wondering,
I don't think everybody even needs these exercises. This isn't like going to the gym and you just do exercises. It's more so if you think, hey, I'm dealing with pain, maybe I try these relaxation poses. Or I'm dealing with incontinence and leakage of urine or stool. Let me try some Kegels and see if that makes a difference. And if it doesn't, you may need a pelvic floor physical therapist. You may need a urologist or urogynecologist. And again, this is for men or women. Anybody can have these issues.
Wait, so there's therapists for this too. What do they do?
It's in depth. They do a lot of internal work, but they also teach people those exercises. They assess to see what is the problem. Are we dealing with tension? Are we dealing with too much relaxation? And they can teach not only with feedback, because a lot of times they're doing some internal work, even with the glove, to tell the person if they're squeezing the right muscles or if they're releasing the right muscles. Sometimes they'll have people put a ball in between their legs, their knees, and squeeze that a certain amount of times, and that can also help the pelvic floor. So there's a number of things that a pelvic floor physical therapist can do to assess and treat.
How much does diet impact all this?
Diet's a big deal. Diet's a big deal. You want to make sure you're eating a diet that's rich in fiber and fruits and vegetables, that you're not dealing with constipation because you're just backed up. You also want to ideally maintain a healthy weight. Being obese or overweight predisposes a person to having pelvic floor dysfunction issues.
Okay.
And exercise, regular exercise that tones other muscles, is also more than likely going to help the pelvic floor.
If you have, say, an incontinence issue or something like that, or loose elasticity, is working out going to make it better, or is it going to be a problem?
Well, it depends on how you're working out.
That's what I'm wondering.
But I think working out is still an important component to managing the pelvic floor.
Okay.
To your point, though, certain exercises you may leak if you're doing the big heavy exercise, big heavy lifts.
Right.
But you need to still do incorporate some sort of physical activity in order to even hope to deal with the pelvic floor.
What is water's role in all of this? Can we drink too much? Do we not drink enough?
Yeah, water becomes complex because everybody should be drinking water, first of all. But if you're drinking a lot of water, now your bladder is not over full, but it's full, and then you're having to use your pelvic floor a lot more to keep it, from leaking. But simultaneously, if you don't drink that much water, your urine's concentrated, the bladder can become overactive and actually just squeeze and try to eliminate what's in it, even if there's not a large volume. So there is a delicate balance there, but water is definitely important.
Clear before 5. So I've always been told, as a runner, clear before 5.
Sure.
Okay.
Whatever that means for you.
I don't disagree.
Okay, thanks, Dr. Wendy. For more info, visit loopobgyn.com. Give them a call or follow Dr. Wendy on social media at Dr. Everywoman.